Hi, my name is Fraser Boyd. I was assigned the musculoskeletal body system. For my case study, I have created a 19-year-old sophomore baseball player as a dual position player, so shortstop and a pitcher, so a high intensity of throwing. We're going to call him Bobby. Bobby is a right-hand dominant player. He's experienced in the past pain, instability, and stiffness in his shoulder. Prior to the beginning of his freshman year, he experienced a posterolateral shoulder dislocation. Throughout the course of the fall, he experienced chronic pain, which is exacerbated post-intensive throwing. He manages this through cryotherapy and non-steroidal anti-inflammatory drugs, NSAIDs. This helps to manage the pain but not completely resolve it. Over the winter break, while performing bench press, Bobby's shoulder gave out, during which he felt a pop deep in the glenohumeral joint. This caused shoulder instability with no strength, posteriorly or anteriorly. Everyday actions would cause incidental pain, as well as edema and posterior ecchymysis. After visiting the on-campus athletic trainer, it is recommended that he go and see a orthopedic specialist for a series of magnetic resonance imaging, an MRI, on his right shoulder. The MRI showed in the rotator cuff there was tendinosis, as well as a mild partial thickness interstitial tear of the infraspinatus tendon at its insertion, with mild adjacent bone marrow edema in the greater tuberosity. It is noted that there is no noticeable muscle atrophy and no visible lateral subacromial spur. In the labrum and the glenohumeral joint, there is a small tear of the posterior labrum at the chondrolabral junction, with the anterior inferior quadrant of the labrum being preserved. There is no indication of adhesive capsulitis or bursitis. Due to the prior posterolateral shoulder dislocation, a chronic Hill-Sachs lesion is observed. Bobby is recommended to receive arthroscopic surgery to place anchors on the posterior rotator cuff, as well as removal of damaged labrum, with tightening of surrounding ligaments to add stability to the shoulder post-labrum removal. This presentation uses a pretty typical college athlete, Bobby. Sort of the process that he would go through in order to get fully diagnosed with a labral tear. Go see the athletic trainer, get referred to a specialist, and get an MRI, as an MRI is the only way to definitively diagnose a labral tear. And then obviously after the surgery, he would go through his typical rehab program with a PT, sort of going through the progressions of regaining the range of motion, regaining the strength, and going back to being able to play, as well as managing the pain and inflammation along the way with that. Sort of understanding the healing process that he's going to be going through is very important for this kind of injury.